Sure. The way Oxbryta works is it actually binds to the hemoglobin molecule, and it increases the affinity of that molecule for oxygen. And by virtue of that increased binding of oxygen, it keeps the molecule in a more relaxed state. So the consequence of that is that it hides the parts of the abnormal hemoglobin molecule because of the genetic mutation that causes them to be sticky and to bind together and form these long chains or polymers. So by preventing the formation of those polymers, you're actually preventing the consequences of sickle cell disease, which is based on the damage to red blood cells that is really ultimately driven by that polymerization process. So and this is in fact the first-in-class hemoglobin polymerization inhibitor. That's the class of drug. It's the first time this class has ever been had a drug associated with it, and it's that mechanism that really drives the expectation that it really is treating the root cause of the disease, and that's the basis in part for the approval that the FDA provided under the accelerated approval path. Yeah. Well, we're very committed as a company to making sure that patients can get access to the drug. We actually have a maybe best-in-class, first time we've ever had this robust a patient support program called GBT Source. And so it's a single point of contact for patients and physicians to figure out how to navigate the access landscape. We do expect, as with the case with new treatments, that there's going to be a period of time when payers, whether they be government or private payers, need to go through the process of making formulary decisions and determining their access plans. But ultimately, our expectation is that access will be broad and that patients will be able to get access to the medicine. And GBT is very committed to supporting that through a variety of means. The GBT Source Patient Hub is one of them, but also through copay assistance and free drug under certain situations with patients in need. So our goal is to make sure that every patient who in consultation with their physician believes that Oxbryta is right for them, that they will be able to get access to the medicine.